why then are we only focused on these three conditions when we have shown that there are a number of mental health disorders and different population groups suffer different mental illnesses? Why then are we really focused on anxiety, depression, and psychosis? And really it's because of three things from a practical point of view, that these are conditions which are very perverse. They affect millions of people. Sometimes it's really not obvious that people are suffering these conditions. We also know that anxiety and depression, from studies, really from epidemiological studies and from clinical diagnosis and from health facility data, that anxiety and depression are two conditions that usually co-occur. And finally, we know that anxiety and depression are comorbid conditions in people suffering psychosis. So if we needed any reason why we would focus, if we only had enough time to focus on three conditions, if we were to rank which ones we would go for, then that would take us back to anxiety, depression, and psychosis. But there's also another reason. As I said again, this Mental Health Data Prize is actually funded by the Wellcome Trust. The Wellcome Trust have a new strategy on mental health, and I would welcome you to visit the welcome.org website to have a chance to review this if you hope to package your proposal well for this prize, but also just to position your research going forward. The strategy wants to create transformative change by finding better ways to intervene early so that people suffering anxiety, depression, and psychosis can thrive. You'll find that on their website. But I want to bring us to these three things, what your projects should contribute to. Not necessarily this project, but going forward, if you're interested in carrying out research in mental health at the population level, your project or the research you do should allow us to better understand how the brain, body, and environment, that interplay of these three key, what I call the components of life, how they interact, and how then they predict, these conditions. But to what end? So that we can be able to identify key points to early and effectively intervene on these conditions. We should also studies or projects or research proposed should help us to better understand ways of identifying and grouping individuals who suffer from these conditions, because one of the things that has really been a challenge, and this links back to many other things, including cultural issues, traditional issues on how we conceptualize and define mental illnesses or mental disorders. So having said that, we should be able to learn from projects that are designed in this day and age on how we can be able to rightfully measure this and therefore properly group people, including identifying other factors, whether at the individual level, at the community level, at the social level, as well as in the environment that can predispose people to suffering mental illness and disorders. So it goes beyond studying the individual. It extends to studying the community in which they come in. It extends to studying the environment in which they live in. It extends to knowing the social environment around them to be able to properly classify and therefore intervene better. And finally, we need to find new ways of intervening, because if we keep doing things the same way and hope to see different results, I think we're lying to ourselves. And I think that's not my word. We know this has been said. We relate with this saying, and it's about time that we change the way we do things. Perhaps we will find better results. And in this case, to bring to the fore issues around mental health and to find solutions for these pervasive conditions that are disabling a number of very, very many people, millions of people, especially in this part of the world.